Do you want to feel better, have more energy, and be your best and healthiest self? We want the same for you, and that's why your friends at the Total You Show are connecting with top industry experts to deliver the best information to you right where you are. Please welcome your host from the Total You Show.
Hi everyone, and welcome to the Total You Show. This is Season 2, Episode 17. I'm Linda Bailey, owner of Total You Health and Total Equine Health. And today I'm doing a solo cast. You know, we are definitely still living in crazy times, and who would have thought back in March we would still be dealing with a pandemic right now? Given how much attention there is on that and hearing that numbers of cases are on the rise, I want to devote this podcast to talking about inflammatory conditions and what you can do about them. And so why is this something that I'm dedicating a whole podcast to? Because inflammation can wreak havoc on your entire body. Whether you experience any kind of pain, have a chronic condition, or are recovering from COVID, most every one of us have some level of inflammation in our bodies. So first off, what does the medical community say about inflammation? Did you know the most accepted reason by the medical community as to the underlying cause for most chronic diseases is inflammation? That's right. But how do we get so inflamed to start with, and what can we do about it? Well, I have written an ebook. I actually wrote this several months ago, and you can get a copy of this for free. It's called Healing from Within, and you can go directly to our website. I will provide a link above. But just in case you want it now, it is totaluhealth.org, and there is a button right there that it says, "Get me my free ebook." So it's called Healing from Within, but I discuss in detail how we get inflammation. I give you a list of foods that you can eat to better support the body. I also talk about foods and things to stay away from to lessen inflammation. And there's a lot more that I go into. But again, it's free. It's only 14 pages. I really just want you to have this as a resource, but mainly just know that there are things you can do that are in your control to improve your condition. So you might say, well, that's all well and good, but I know someone who's had COVID and has multiple organ systems that are inflamed, and I need something that I can act on quickly because my friend is really suffering. Well, good news. I'm going to tell you about a recent news segment that focuses on a doctor outside of Boston and the treatment that he's done on actual COVID patients with success. So even though there's still a lot that we don't yet know about this infection, we do know their inflammation plays a big part in it. The good news is there is something you can do if you have that is non-toxic, non-invasive, and it may help you recover faster. And the best news, at least for those of you local, it's right here in Roanoke. If you're listening and you're outside of the Roanoke area, you can always go to novothor.com/locations, and you can find an office near you. But there are places all over the U.S. that might be able to help you. Again, I will have those resources listed above so that you can refer to those in a bit. But I'm going to provide a link to the news segment that I'm speaking of, and it aired recently on an ABC News affiliate in Boston, and it features a Dr. Scott Sigmon, who's an orthopedic surgeon at Lowell General Hospital. He is working to provide a non-toxic, non-invasive treatment for COVID-19 patients using cold laser therapy. So you'll see before and after treatment x-rays of the lungs of an actual COVID patient and see for yourself how effective the therapy was just after 4 straight days of treatment. So for those of you who don't know, the doctor's going to refer to this therapy as cold laser therapy. Photobiomodulation therapy is the overall umbrella term that's used for all red light therapy. So the terms you may hear are cold level laser therapy, cold laser therapy, red light therapy, low-level laser therapy, they all have to do with photobiomodulation. So I just wanted you to know that these terms are sometimes interchangeable, but they all reference the same type of therapy. So within this type of therapy, there are definite differences in equipment, mainly concerning the dosage each one uses. And that is a podcast for another time. But in my opinion, photobiomodulation should contain both red LED light at around 660 nanometers. We're not going to go into all that detail right now, but it should also include near infrared light at around 850 nanometers. So this is the type of PBM therapy that we use at our office at either Total U Health or Total Equine Health. We've been in business over 2.5 years, but I've used this therapy going on 8 years now. And within that period of time, we have seen some really remarkable results for conditions that range from various types of arthritis, fibromyalgia, Lyme disease, MS, spot pain like low back, knees, lupus, but also as well as depression, anxiety, and PTSD. So it's no surprise to me that COVID patients are seeing good results using it as well. So why, in this news segment, how does the therapy work as far as in scientific terms? You're going to hear the doctor describe it. I'm going to explain it, though, in terms that most everyone can understand. When we're exposed to toxins in our environment, such as through viruses, bacteria, chemicals, our cells get stressed. And cells also get stressed when we have an injury or if we experience a trauma. And in a stressed condition, the cells give off nitric oxide, and that binds with other material in the cell, which blocks out oxygen. Now, you may think, why is that a big deal? Well, low oxygen or oxidative stress in our cells is a big deal, mainly because our cells need oxygen to make its energy. When the cells don't have enough energy, they can't function at 100%. And that is what leads to inflammation. Well, guess what? If our cells aren't functioning at 100%, neither are we. So it's no wonder a lot of us are walking around with low energy, lots of inflammation, and we just plain don't feel good. So the way red light therapy works is that at the right dosage, and that's the key when finding the right equipment to have the best outcomes, is the dosage. The light penetrates to the mitochondria of the cell, the powerhouse of the cell, and that causes a reaction that releases the nitric oxide from the cell. So once that happens, there's more room in the cell for oxygen to come in so the cell can make energy to do all its necessary functions. So clients can actually tell when this is happening every time they come to Total U Health, because closer to the end of their session, they actually may feel a bit warmer. And it's not because the bed is getting warmer, it's because the cells are shedding the nitric oxide, which allows more room for oxygen to enter so the cell can produce energy from it. So producing energy sometimes causes heat. So this is why towards an end of a session, the body might feel warmer than it did when the session started. So I am going again to encourage you to watch the news segment. It's only about 1.5 minutes long, and hear from someone in the medical field talk about how it was helpful for 2 COVID patients. I also strongly encourage anyone who has had COVID who may still be struggling with inflammatory conditions to please try this therapy. Again, there's no drugs involved with it. There's no needles involved. And best of all, there's no contraindications or side effects with it. We just would not see somebody who's pregnant. I'm also going to put a link to a study done on COVID-19 patients as well that mentions low-level laser therapy as a modality to enhance recovery and reduce the use of ventilators. These are powerful, folks. So another link I'm going to post is a link to a podcast, and it's called Upfront. It's about 30 minutes long, and 13 or so minutes into it, Dr. Sigmon, who I referenced already, is interviewed along with some other doctors, but he specifically mentions how this red light therapy may seem a bit off the radar. And he was actually asked if he's had pushback from his peer network. And Dr. Sigmon replied with, light therapy is not that well recognized in North America, but throughout the rest of the world, it is an absolute demonstrated clinical treatment option. So there is huge pushback here in the U.S., mainly because it's not in the medical curriculum. So therefore, doctors don't know that much about it. And when you don't know something, as a general rule, if it hasn't been taught to you, the first assumption is it doesn't work. So don't be surprised if you approach your doctor and ask him or her about this, if they're kind of, taken aback and, kind of shrug it off. Evidently that's common. We're hoping that it will become more common so that that's not going to be something that continues to happen. But I am going to post the link to Dr. Sigmon's published study that uses the laser therapy on his COVID patients. And you literally, in that, can scroll through and you can see the difference in the actual chest x-rays of these patients. But you know what? Above all of this, go do your own research. I always encourage people to do that. If you Google PubMed and low-level laser therapy, there are more than 7,000 peer-reviewed articles just about this therapy alone for everything from pain management, wound healing, to brain injury, cancer, and a lot more. So, in case you're interested, again, I'm going to post the link to that entire podcast episode. Again, it's about 30 minutes long. But one other really nice thing is at the end of that podcast, they actually interview one of Dr. Sigmon's COVID patients. She was dangerously close to be admitted to intensive care and being put on a ventilator. And this therapy kept her from that. And by day 3, she could tell a big difference in the way she felt. Also, really cool thing that happened while she was being treated with this laser therapy, doctors could actually measure and see her oxygen levels going up during the treatment. That's pretty powerful. And lastly, this patient was able to come off of her oxygen within a 4-day window, and she was discharged to go home 2 days later. And this versus most COVID patients where symptoms linger for weeks to months, and unfortunately some never make it home. So those are huge results. Again, it is safe, it is non-invasive, it's FDA approved. So what are you waiting for? Don't suffer. Come see us at Total U Health, or if you're out of town, look up novathor.com/locations and go to another business that has this therapy so you can start feeling better again. So that pretty much covers inflammation from a COVID standpoint. But what if you have a condition that isn't so critical and you don't need an immediate medical attention? What do you do about that? Well, again, you can check out my ebook using the link. But in a nutshell, because we can't live in a bubble, we need a way to protect ourselves from the toxins that we are exposed to every day. So eating foods high in antioxidants will help. And these lists are all in that ebook that I just mentioned. There's also ways to support the body to withstand all these environmental toxins. These environmental toxins can actually cause a lot of damage to our bodies. And in my free ebook, I mentioned there's 8 ways that these toxins can hurt our bodies in a major way. If you don't know if you have inflammation, in the ebook there are a list of some of the signs of inflammation. But even if you notice you have some of the signs listed, don't worry. Again, we all have some level of inflammation. But there are things you can do besides eating healthy that can improve your inflammation level. So again, read the free ebook and you can find out a lot more about that. Again, the link is provided above. And lastly, I just hope that this edition of the Total You Show has been helpful for you or someone you may know of who might be suffering. So I urge you to please check out all the references I've mentioned. Get the ebook if you think it may be helpful. But most importantly, come see us if this resonates with you at all. You can reach us by calling 540-404-8858. You can go online to book an appointment or learn a whole lot more about what we do here at Total U Health and Total Equine Health. That is www.totaluhealth.org. Or you can ask us any questions by calling or via email, which is info@totaluhealth.org. Either way, we hope we can help you soon. Until next time, stay safe and stay healthy. Bye.
That's all for this episode of The Total You Show. Be sure to subscribe to our YouTube channel, podcast, follow us on social media, and tune in to next week's episode. Helping you achieve the healthiest version of you, that's Total You.